ambulance service. The patient breathing?
I'm not sure. There's blood streaming from his head, and he's not moved. He lost his foot and he started to run down the hill, and then he fell onto his face. Oh, that looks bad.
How old was the man?
67.
Do you know?
He's my brother.
Scotland is huge. Swathes of it are remote and far from immediate help.
Is patient accessible?
He's in the middle of nowhere.
People want to go to the extreme.
We're coming as fast as we can, okay?
And that's when they get into trouble.
Emergency call for Hillside 5 and trauma team.
I think she'll be a really difficult extrication from the rocks.
For many serious trauma patients, they may not survive if they have to wait to get to hospital to get the treatment that they need. That's why we have to bring the emergency department to the patient.
Responding to the most serious emergencies.
We are on scene attempting a land-on, over.
Scotland's National Trauma Network dispatch elite clinicians to those in need.
Trauma team on scene.
Whether it be halfway up a mountain, at the bottom of cliffs, in overturned cars.
I need 17 minutes.
It's the difference between life and death.
Right, I was in.
Saving lives.
I cannot feel a radial pulse.
No matter where.
We've just got eyes on them.
A man has fallen on a remote hillside near the historic mining village of Twecker.
He's not moved from the spot.
His injuries are life-threatening.
I'm organising to help you now. Stay in the line, I'll tell you exactly what to do next.
On the major trauma desk in Glasgow, specialist clinicians assess priority 999 calls.
Emergency call, trauma team by road, general area of Twecker. Emergency call, trauma team by road, general area of Twecker.
An emergency trauma team are on standby for the most serious of cases.
Got a 67-year-old male who's had a fall and is now not responding, and blood coming from mouth.
Retrieval practitioners Darren and consultant Dave are immediately dispatched. 999. They are 19 minutes away from the hillside, with a local ambulance crew also en route ahead.
I'm coming through now saying that approximate road access is 1 kilometre away from where the patient is.
This patient is at the summit of Bar Hill.
Near the Roman fort.
Roger, that's all received. Is this pointing us to the access to that point?
Correct.
I'm just trying to find exactly where you are. Bear with me.
It's quite difficult, isn't it?
It's just because you are in the middle of
nowhere.
HEMS call for Hillside 5, general area of Twecker. HEMS call for Hillside 5, general area of Twecker.
To help extricate Walter, it is decided the air ambulance will assist. Helimed 5 is dispatched.
3353, go ahead.
This is up the top of a hill at the old Antonine wall. The access is going to be extremely difficult, so we're asking Helimed to go. This Helimed will likely be first on scene.
It's going to be a difficult extrication.
Yeah.
The hill is approximately 1 kilometre from the nearest accessible road. A local fire crew and a Polaris specialist off-road vehicle are also en route to support.
We are coming to you as fast as we can.
I don't care, I can't help him, I can't help him.
Is there any serious bleeding? Is it spitting or pouring out?
Well, you see, he's had a brain hemorrhage before, so his head's a bit weak.
Patients that have a history of a brain hemorrhage may have an underlying predisposition to further similar episodes.
Just ahead, turn right.
If you fall and bang your head, you can cause bleeding in the brain.
Right.
The skull has got a finite volume, and once that amount has been reached, there is nowhere for that blood to go. Ultimately, it can actually mean that the brain can no longer function at all and can cause death. Time is of the essence.
Darren and Dave rush to the hillside, 1 kilometre away. Above them, Helimed 5 is attending the patient by air.
Walter, he's weak. He is moving his legs. Don't move, Walter.
Don't move from unless he's in any danger, okay? And if you get something any worse, just let me know straight away.
Me and my brother have done that walk so many times, we know like the back of our hands. Walter just loved being out there. Walking was his thing to keep himself fit.
We've just got eyes on them, thanks, Stephen.
No problem at all, thank you.
When he tripped, it happened so quickly, he started to run, so he actually ran past me. It's just a straight fall. It was just full impact onto his head.
Walter is located, but the uneven terrain forces Helimed 5 to land 200 metres away. A Helimed paramedic goes ahead to assess the patient as the rest of the aircrew carry down life-saving equipment.
Helimed 5 on scene.
Right, this is Walter, 67-year-old, out walking with his sister. They're up at the top where we've landed, lost his balance and basically fell face first. Unconscious for a period of time. He's not making anything verbal.
Because of his previous brain injury, he was very, very careful. He knew himself how lucky he was the first time. So why did this happen?
I'm going to pop a wee mask over your nose and mouth, okay?
He's my big brother. He's the strong one. He's always been there. But a blink of an eye can be so quickly taken away from him.
Walter, can you talk to me, pal?
Walter? Walter? Walter, I just need you to straighten that arm for me.
It's been 4 minutes since the air ambulance crew attended 67-year-old Walter, who fell, injuring his head whilst walking with his sister.
We've just got eyes on them.
The trauma team with consultant Dave have arrived by road.
Hi there. Are you partner?
She's sister.
We'll have a wee look at them and then we'll come for a wee chat, is that okay?
We're up at the top at the strike point. We're coming down, starting to run. He's went over, basically, head first, landing on his face. History-wise, had brain hemorrhage in 2003.
Walter, squeeze my fingers! Do you know where you are?
What age are you, Walter?
34.
34. Do you know what day of the week it is?
So he's
confused. If we are dealing with a patient that may be knocked unconscious, has very little recollection of what happened, appears to be confused, these are all factors that can mean the patient's potentially had a more serious blow to the head.
Take some deep breaths, Walter.
If you have significant pressure on the brain and the brain stem, which controls many of our involuntary functions, such as breathing, we need to make sure that the patient's got normal oxygen levels and normal blood pressure. And often with a serious head injury, that means intubating the patient.
So we need to pop him off to sleep.
This is a very challenging procedure, never mind carrying it out in a very challenging environment.
OK, check is complete. We're just going to give you some medicine now, OK? Ketamine's going in. I'm going to give 160 milligrams.
It involves administering drugs which would make that patient unconscious enough and paralysed enough so that we can actually pass a small tube down in through their larynx and into their lungs and enable us to then ventilate with oxygen.
This really won't be straightforward, just to warn you.
Yes, but
this is done as a life-saving procedure.
Intubating Walter is more complex because his body is at an angle on the side of the hill.
The terrain can be quite difficult. Providing these sorts of interventions, even in the hospital setting, can be fraught with potential difficulties.
It's a terrible, terrible view.
The intubation can be unsuccessful, and you're actually paralysing a patient to do that. So you can actually make the situation worse. So we would only carry this out if it was deemed completely necessary.
Is that okay there?
I can see the cords.
It was such a relief when the medics started working on him.
SATs of 100, Dave.
It was unbelievable. And what they did there, all the tubes and things like that, it was total hands-on. But it is quite hilly, and you're basically in a wilderness. So it was just no worry.
Pulse rate. I could feel the tracheal
I
rings.
feel that as well. Yeah, I can feel that. I'm happy with that.
The team needs to ensure oxygen is now reaching Walter's lungs.
Air entry both sides, nothing in the stomach. That's what I like to hear.
Beautiful, and he's got a really good trace, that's 100. Happy. So that was about 12:51, we'll call it.
With Walter intubated, the priority is to get him to hospital urgently.
But I don't think we're going to get in the back of the helicopter, Dave, because it's on the edge of a hill and it drops. Okay, he's now off to sleep. So we've got control of the situation now.
A specialist off-road vehicle is en route to transport Walter to a nearby ambulance.
Okay, I'm happy.
1, 2, 3. Oh, Brian. I'm really sorry to hand you this in the state it's in, but I know there's money in there.
Thank you. Walter was born in the village of Croy on the 5th of February 1955. He was the size of a sumo wrestler when he was born. He was a fat baby. He stretched. He was the blue-eyed boy. He loved being outside, running around with his friends. You had all the countryside, so you'd explore anywhere and you were safe. It was 7 years before I came along. We did play, but he had the upper hand a lot of the time. He took being big brother, took that responsibility very seriously. We could talk to each other. We could say things, yeah. Laugh with each other, yeah. We never ever said we loved each other, but it's just something we knew.
Queen Elizabeth. We have a gentleman who's like a traumatic fall, really head injury.
Male was mountain biking and has hit his head off a tree. Pain in his back and his legs are numb.
I've got a serious call by the looks of it. A gentleman come off a quad. So where I'm looking, I don't even know if it's going to be accessible for you.
Ambulance emergencies, the patient breathe in.
Yeah, but just bleeds like hell.
Okay, what part of the body's injured?
It's a right arm.
Okay, tell me exactly what's happened.
He cut herself with a chainsaw. Oh!
In control, trained specialists continue to monitor the most serious of cases.
The crew was allocated to a 63-year-old female. It was a cut to her arm with a chainsaw, unable to control the bleeding. This could be something quite horrific.
The incident has happened on the patient's half-acre of land in Bogbury, a hamlet of Aberdeenshire.
Get a dry clean buffer towel, place it right on the wound and press down firmly. Is the bleeding still seeping through it?
Aye.
Oh no. Oh, I feel faint.
Feeling faint. Need somebody here quick.
We are arranging help for you now.
The nearest major trauma centre to the patient is in Aberdeen, 21 miles away.
What's coming in?
63-year-old. Her partner is caught her on the arm.
Within your arm, you have got major arteries, which, if they are cut, can bleed considerably, and the patient can lose a lot of blood very quickly. If the bleeding isn't controlled, the patient can have a cardiac arrest. Worst case scenario is that they could die.
Trauma call to resus in 15 minutes.
It was the dream to settle down and just generally enjoy the countryside, where there was ground where we could garden and grow vegetables. But we are far off the main track. We were cutting up firewood. Liz was holding the sticks. The blade went right through. She said, "You've got me." And the blood started to pour out. It just happened so quickly.
Paramedics have controlled the bleeding on scene.
Get this access, give some TXA, unwrap and have a little look what we're dealing with.
Doctors first need to confirm there is blood flow to the hand.
Very delayed cap refill of about 7 seconds there, with obviously altered sensation. I'm not convinced I can feel a radial or ulnar pulse.
The radial artery is one of the big blood vessels in the forearm and supplies blood to the hand. If there isn't a radial pulse, it suggests that there might not be blood flow in that artery. Tissues need a blood supply in order to receive oxygen. If that blood supply is interrupted and they don't receive the oxygen, then the tissues can die and ultimately could lead to an amputation.
There might be some damage to some underlying structures, so things like bones, blood vessels, nerves. If that is the case, then we'll try and repair those for you as best we can. We need to have a look, first of all, to see if we can see that anything's been damaged. What I don't want to do is when I release all of this, it suddenly start bleeding again and we've not done what we've needed to do beforehand.
Right.
Ooh.
Sorry.
I relived that situation time and time again. You can't describe how bad you feel when you injure someone that you care and love for to that degree.
He's got a decent bruising and swelling around his eyes, isn't he?
Walter is being rushed to the Queen Elizabeth Major Trauma Centre with a potential life-threatening head injury after he fell walking with his sister.
Entitled 3.9, still a bit hypertensive. So we try and bring his blood pressure down a wee bit, just a wee bit more morphine.
I think we'll just lift them up and over on the scoop. Right, we'll get a quick primary survey.
Good bilateral air entry, equal chest expansion.
He's got blood coming out of his nose. A depression in the right kind of frontal, bruising over his left eye in particular.
He's peripherally quite cool. If a patient is cold after trauma, could be a sign of significant blood loss, major trauma to internal organs, a traumatic brain injury where the patient's conscious level has been so low that they have not moved and the area that regulates temperature has been damaged. I'm just going to stick the under blanket on, his temp's 34.5.
When a patient's temperature is below 35, they are hypothermic, which can be very dangerous. The main organs start to not function properly. They stop getting delivery of oxygen as efficiently, and you will develop multi-organ failure.
We're going to go to CT.
Taking patients for a full body scan is time critical. Identifying where the injuries are as promptly as possible.
Okay, on 3 then. 1, 2, 3.
He's taken quite a fall. He's got a brain injury, you know, there's no denying that. Wee spots of blood in various parts of his brain. We need the neurosurgical team to get involved. It's really difficult to know what's going to happen and what the outcome is going to be because these things can all get a bit worse. We need to keep a close eye on him.
Can I call the patient breathing?
Hard hit a motorbike. We just found the guy lying at the side of the road.
Oh, hold on, just now. Listen to the question. Is the patient breathing?
Yes, he's just been in and out of conscious now.
Right, okay. Just keep talking to it.
He has blood just pouring down. We just found the guy lying at the side of the road.
Said the motorbike's still in the middle of the motorway itself?
Yes. He's got blood around his eye.
Stay on the line, I'll tell you exactly what to do next.
Emergency call, trauma team by road for Newton Mearns. Male on the motorbike has been knocked off, is currently lying on the road.
The unknown male has come off his motorbike at high speed, landing in the central reservation of the motorway.
Trauma team ETA of 2020 minutes.
Doctors Ryan and Stephen and retrieval practitioner Robin are 10 miles away from the incident.
3253 trauma team, just to advise, male is currently lying on the road. Where it's situated, it may be a bit awkward to get on.
Yes, obviously. Seems awfully busy. It does.
Ahead of the trauma team, the nearest available ambulance and the police are also en route.
He's very dazed and confused. If there is blood, I would say it as an immediate priority.
Unknown to the emergency crews, the collision sparked another call for help.
With his phone, if you have a crash or an impact, it'll automatically phone your SOS. I phoned him back and I shouted, "Philip, it's me. Where are you?" And he said, I don't know. And Emily had the bright idea. She went, "Oh, Mummy, I'll have his phone on him." She says, "I'll track him."
Lynn and her daughter also rushed to the scene of the incident 8 miles away.
As we were travelling up the road, the traffic was becoming heavier and heavier. And the police stopped me. And I said, "It's my husband." "You're helpless. You can do nothing."
3659 on scene.
Yeah, there's obvious impact to the helmet.
He's very confused, kind of very repetitive in his chat.
Just give us your full name again. Philip. When I have it pressed on your legs, you just let me know if they're sore. Okay. So is that your leg? Your back.
Playing on pain, run about his pelvis.
Do you want to start cutting his trousers off?
If a patient who's sustained major trauma is complaining of pain around the pelvis, that can be quite worrying. A fractured pelvis can be very serious, particularly if it disrupts the major blood vessels that sit near it.
Could you maybe put the monitoring on, and then if you could put a canyon on him?
And that can cause quite significant bleeding internally and could be fatal.
Can you get a pelvic splint?
Pelvic splint is a device that's placed across the pelvis of a patient. And then it's pulled tight to try to hold any pelvic fracture in a stable position and try to stop any further bleeding.
Just going to pop a wee needle in the back of your hand.
got some right-sided chest wall pain.
Looking at his chest from here, his left side of his chest looks hyper-expanded to the other.
One of the things that we can be concerned about with significant chest trauma is a collapsed lung. At its very worst, and if it's untreated, it could be so serious that it becomes life-threatening.
Get him onto the scoop, get him into the back of the ambulance.
Ready, set, roll. I can't breathe. You need to put me back now.
Okay.
We're going, mate. We're going. Ready, set, down.
A collapsed lung could be identified by signs from the patient, how the chest looks or how it feels, and increasing difficulty breathing.
Roll.
Emily was terrified, and there's nothing you can say because you don't know the answers.
Can we get you up to the hospital in Glasgow, okay?
We just held hands in the car and cried together.
Ready, set.
It was just a terrible, terrible day.
So how did you manage that? Are you left-handed?
No, it was my partner was cutting the wound, and I was holding on the end of the wound, and the chainsaw came up and cut my arm.
So it's a murder attempt, was it?
Chainsaw massacre.
63-year-old Liz needs her arm urgently assessed by a plastic surgery specialist.
Hello, Elizabeth.
Hi.
The concern is that we don't know exactly how deep that wound is and what the extent of the damage is. We need to do some more investigations as well. In terms of your hand just now, say if I touched you here, can you feel me touch you?
Yep.
And here?
We have used the chainsaw in the garden for some time now for cutting firewood and cutting trees down.
Very good. Okay, just relax your arm down now.
We enjoy the outdoor life. I call her my wee foal. She calls me her hairy beastie.
Can you make a fist for me? Tight as you can.
When Liz was in the hospital, it was the first time ever we were separated. I felt absolutely terrible.
Now, as wide as they'll go like this.
You only meet one correct person in your life, and Liz is the one for me.
Can you bend the tippy bit of your thumb?
We are engaged, been for the last 20-odd years.
Very good.
She likes to keep me on my toes, you see, so...
When did you last have something to eat?
This morning with breakfast.
Breakfast this morning?
About 9 o'clock.
That's 9:30 this morning. Okay. Don't have anything more to eat just now?
No.
Okay. I think given the wound, we likely want to take you to theatre for an operation to have a good look inside of the wound, get a good clean and see if there's any structures that are damaged. There is a chance that a nerve or an artery was hit by the chainsaw. We'll do a CT scan as well, a CT of blood vessels, okay, just to see if there's any damage to them that can be picked up from the scan.
Liz must have an emergency scan on her arm.
So we're going to give an injection of extra dye just so the doctors can see all the blood supply to your arm, okay?
Any part of the body needs a blood supply in order to survive. When we suspect that a patient has damaged a blood vessel, we have to do an investigation called a CT angiogram, where the patient is given an injection of dye. Dye travels along the blood vessels and we can see where it's travelling, and if the vessel is injured, then the dye will leak out of that blood vessel, so we can pinpoint where the damage is and how severe that might be.
Elizabeth, I'm just starting the injection of the X-ray dye.
Breathe in and hold your breath.
There are pulses, but it's weak. So I think it needs exploring tonight.
The major artery in her arm is intact, but the full damage is unclear. Liz will be taken to theatre for surgery to save the function of her arm.
Emergency call for Hillside 5, trauma team. So it's 3 children in the water, one's drowning. We have a 27-year-old female. She's been kicked by a horse in the chest and abdomen.
I've landed on my right elbow and my right hip. I can't feel my legs.
En route to the Queen Elizabeth Major Trauma Centre is 56-year-old Philip, who came off his motorbike at high speed.
Medical standby, 5 minutes.
First positions, please, ladies and gentlemen. First positions.
Right, here they are.
She's hard, like you just heard it a lot.
1, 2, 3.
Slowly.
Well done.
Philip, I'm just going to have a feel of that chest of yours, okay?
Yeah.
Let me know if it's sore anywhere.
Sorry.
I'm afraid you need to lie flat for now until we know what injuries you have, okay? Because any movement can make things worse. Is that okay, sir? Okay. Just concentrate on your breathing, okay? All right. There is a chance that you've got some injuries which you can't see at the moment. We need to do a scan. It's called trauma scan, and that'll be a scan from top to bottom. Is that okay, sir? Good.
The worry is that he's got a significant chest injury and that we might need to do some intervention.
Yeah. Right, shall we go, guys, to the city?
No, they won't let her in the room at all. All right. I promise as soon as we can get her in to speak to you, we'll get her in, okay? Okay, let's go.
I've always worried about Philip going out on the motorbike. He likes the speed and the thrill. And I always used to say to him, you know, I hate getting out on the motorbike, and he would always say, so I'm a good driver.
We're going to 3. 1, 2, 3. Okay.
Growing up, I don't think he paid too much attention at school. I think he was more interested in racing bikes and sports cars, and then girls. He married at 21, and he had 3 children, 2 boys and a girl. He loved being a dad, and I guess when he was in that marriage that he felt that that would be his forever, and things didn't work out. When his marriage broke up, the eldest would be 9, 7, and the youngest was 2. He was absolutely heartbroken that he wasn't being able to be the full-time dad. And that was hard on him. Hard on him that he didn't have the relationship that he wanted with his children.
I think it's the panicking.
So he was just broken.
Are you okay? Why? Phyllis, listen to me, mate. We need to get this gun done ASAP, okay? Good man.
He moved in with his sister Esther, and that's when we met.
Walter? Walter? Walter?
It's been 24 hours since Walter sustained a traumatic brain injury whilst hill walking with his sister. Doctors are trying to wake him from a drug-induced coma.
He used GCS 14 at the scene, and it's very clear that he didn't have any significant neurology. He has got intracranial bleeds.
So he's had an MRI of his C-spine requested, hasn't he?
Yes.
The full CT report has also revealed a fracture to his neck.
He does have a cord injury there. That may be evolving over a bit of time.
Yeah.
We need a plan from spinal surgery / neurosurgery. Oh, he's just starting to open his eyes, I think. Walter? Walter? Walter. Not waking up. He needs an EEG and a rescan of his head.
Neurological specialists arrive to measure the electrical activity in Walter's brain.
Walter and I have always lived together. We're very, very lucky to have a connection between us that has obviously been nurtured through the years.
It's okay, Walter. We're just doing a little test on your head, okay?
There was a lot of laughter, but there was sad times too. In 2003, at work, there was a lot of pressure on Walter. He was starting to worry that he was going to lose his job. He did start to see the difference, I know. He would be withdrawn, because he was a talkative guy, but once, you know, if something is truly getting to him, worrying him, he would be withdrawn.
If you can hear me, try and open your eyes over, Walter. Can you open your eyes?
That's when you knew something was definitely terribly wrong. At work, they were having a meeting and he did collapse at the meeting. And I don't know why, they brought him home instead of maybe getting him to a hospital there and then. And he was swaying back and forth, back and forth. I was in shock. I had to protect him, I had to help him. We have always looked out for each other. You've always got to have someone. I don't think anybody can cope truly on their own.
Walter, can you try and give my hand a big squeeze? Can you squeeze my hand for me? Give my hand a big squeeze. No? Okay. Listen here, and I'll pull some chairs down for you. Go around to the chair.
Walter. Walter. It's Rosemary.
He's got some bleeding within his brain. He's also got fractures to the bones of his spine. Okay. So it's really what's going on inside his head and in his neck.
Yeah.
That are the two big areas of concern at the moment. And so what we're planning to do is to get a scan, an MRI scan today.
If we have patients who have very severe brain injuries, we would look to see if there's any brain activity. If there is no brain activity, likely means that the patient is not going to survive, even if their heart is still beating and they're on a ventilator.
Don't move him unless he is in any danger. Do not splint any of his injuries. Just tell him to be still while you are waiting for us to arrive.
Going in and out of consciousness.
Get a code red. Our ETA is probably about 10 to 12 minutes.
899, the Helimed trauma team are en route.
In Glasgow, 56-year-old Philip is awaiting the results of CT scans after he came off his motorbike at high speed.
I think I see my wife. I can't bring her in right now.
Get her in just shortly, my friend, okay? I promise you.
Once we get the report back, then obviously we can bring them in and we'll have a chat. All right?
Philip's wife and daughter have been waiting for an update in the relatives' room.
Hello, hi. My name is Dr. Alani, pleased to meet you. Yes, I'm sorry what happened today. The mechanism of injury is significant because, you know, he was on a motorbike, high speed involved, serious. He's in a lot of pain. You need to wait for the formal report by the radiologist.
I first met Philip when I was 27 and he was 32. Hogmanay, 1998, there was a ceilidh on and I ended up dancing with Philip. We just got on really well and I thought, oh, you know, he's lovely.
What I'm going to do now, I'm going to remove these two, we call them blocks, okay? And then I'll gently feel the back of your neck. This is just a kind of further assessment.
He was eventually my husband. I was overjoyed to be married, and we got pregnant almost immediately.
Now gently look at your right side.
Philip was just so happy, but I didn't have a great pregnancy. I went to the hospital 3 times a week to be monitored, and then they had said, your bloods are significantly off, you're starting to go into kidney failure. They took you through to theatre and they took Philip to a separate room to get into his scrubs. And I do remember saying, where is Philip? Is he going to miss it? And then he came through, I gave birth. It was just the most wonderful thing. She was just absolutely beautiful. Just perfect. Absolutely perfect.
Just keep your head still. Yeah. Just feeling the spine, you know, the back of your neck.
Yeah. Yeah, it's really tight, that.
Yeah, it will be tight, okay? Yeah.
Philip loved being a dad. They're very close. At 4 or 5, she was on the bike with Philip. She wanted to go out with Philip. I always worried about the two of them and being out.
Don't move.
That day of the accident, usually he takes Emily with him. I said, don't you dare ask her, because if you ask her, she'll say yes. When you add up the odds of what happened that day, I could have lost him. 5 motorbike crashes that weekend. Philip's the only one that survived. You have to make every moment count, because you don't know when your moment's up.
All right.
No.
I don't remember anything.
It's okay.
I don't know what happened.
Because you cracked your head.
Doctors now have Philip's full CT results.
You do have a fracture of your collarbone on the right side. You do have a fracture of your shoulder blade, again on the right side. You will need to stay in hospital. The mechanism of injury is significant, so sometimes what happens, the patient starts to become unwell, deteriorate, then, you know, they will need further scan, okay?
I'm feeling much better, although I can only get my arm up this high at this point. I start physios soon. My daughter Emily would have been on the bike with me 100% that day. I'm so grateful that I didn't ask her.
It's been marvellous what they've actually done. They repaired the wound, they cleaned it out, they repaired the veins, and then they stitched it up. I'm feeling great that I'm actually to get back out into the garden again and being back to my physical self, doing what I usually do with Donald. The consultant says you've been very, very lucky. He says, please don't use a chainsaw again. And I said, no, it's okay. Till the next time.
Walter, can you hear me?
Can you try and lift your wrist up in the air? Try and lift your hand off the bed. Try and lift your palm off the bed. Post-brain injury, we start with very small goals. There's a lot of observation, assessment and monitoring for quite a long time. Let's just practice bringing it to your mouth. We always aim to get that person moving because we know that when we move somebody, it stimulates the neural functions. We don't know ultimately what the long-term outcomes will be, but we're there to support and help them at all times.
Walter never done anybody harm. I mean, he just wouldn't, and these couple of things to have happened to him is hard. That we've got each other and we will continue to look out for each other as long as we are together.
I'm very, very lucky to have the rock in my life that's Rosemary. There's no doubt about it. My life is wouldn't be the same if she wasn't there. Got a second chance. Not many people get a second chance. That's a big, big thing.